The knee is the body's largest joint and it has fairly a complex structure. This joint is needed pretty much for any form of movement such as running and walking. The patella is covered with a layer of smooth cartilage which normally glides across the knee when the joint is bent. Today let's see a condition from musculoskeletal system which affects the kneecap, that is called Chondromalacia Patella. This condition is also called runner's knee. It is a common condition causing pain in the kneecap. So guys, welcome back to yet another episode of Med-Surg Mentor, and today let's see this condition in detail. Chondromalacia patella is defined as the softening and breakdown of the cartilage on the underside of the kneecap or patella. Common etiologies of chondromalacia are abnormal kneecap positioning, tightness or weakness of the muscles associated with the knee, too much activity involving the knee, flat feet, poor muscle tone, and overdeveloped vastus lateralis muscle. People who are at risk for developing chondromalacia patella include people with high activity level, those who have overweight, injury, fracture or dislocation related to the kneecap, runners, soccer players, bicyclists and other people who exercise often, teenagers and healthy young adults, more often females, and those who have conditions like arthritis. Next is pathophysiology of chondromalacia patella. Due to etiological factors like overuse, there is degeneration or microtrauma of the articular cartilage on the underside of kneecap. These changes in the articular cartilage results in softening of the cartilage, and gradually swelling and pain occurs when the underside of the kneecap comes in contact with the thigh bone. In this picture, you can differentiate between normal and abnormal kneecap. In normal knee, the articular cartilage is intact, whereas in chondromalacia, there is damage to the articular cartilage resulting in rubbing of patella and femur. Common clinical features of chondromalacia patella are dull aching pain and tenderness that is felt at the front of the knee, behind, below or on the sides of the kneecap, a feeling of grinding and pain when the knee is flexed while doing knee bends, going downstairs, running downhill, standing up after sitting for a while, and sitting for a prolonged period. Next is grading of chondromalacia patella. Grade 0 is considered as normal, and in grade 1 there is cartilage signal abnormality but appears architecturally intact. Grade 2 indicates softening of the cartilage along with abnormal surface characteristics involving 50% of the cartilage thickness. In grade 3, there is defects involving more than 50% of the cartilage thickness. And in grade 4, there is full thickness cartilage defect or loss with associated bone marrow edema. Common diagnostic measures done to rule out chondromalacia are history collection, physical examination, blood test, standard knee X-ray, MRI scan, and arthroscopy. There is one more test done to detect the presence of patellofemoral joint disorder, and this test is called CLARKE'S test or patellar grind test. And in here, The patient is positioned in supine or long sitting with the involved knee extended. The examiner places the web spaces of his hand just superior to the patella while applying pressure. The patient is instructed to gently and gradually contract the quadriceps muscle, and a positive sign on this test is pain in the patellofemoral joint. Major complication of chondromalacia is bone-to-bone pain, which occurs when the ends of the bones rub together. Important managements of chondromalacia patella are use of an ice or cold pack, elevation of the affected leg, administration of non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen, topical pain medications, low-impact activities such as swimming, and resting of the knee to avoid repeated stress. Other managements include losing weight, using special shoe inserts and support devices, taping to realign the kneecap, wearing the right kind of sport or running shoes, create muscle balance by strengthening quadriceps, hamstring, abductors, and adductors. Let's move on to the surgical management of chondromalacia patella. Here, orthopedic surgeon performs chondromalacia surgery to remove the damaged cartilage. The goal of the surgery is to help remove or fix damaged tissue and cartilage surrounding the knee. The surgical procedure can be done by arthroscopy or by open knee surgery. Next is tips to prevent chondromalacia patella, and they are: avoid repeated stress on kneecap, wear knee pads if spending time on knees, create muscle balance, wear shoe inserts that correct flat feet, do not neglect the knee pain at the beginning stage, do exercises to promote joint mobility, warm up and stretch before participating in sports activities, increase intensity of the training gradually, and ensure a balanced diet. Important nursing diagnoses for patients with chondromalacia are acute or chronic pain related to bone-to-bone rubbing, impaired physical mobility related to pain and stiffness, activity intolerance related to pain and weakness, knowledge deficit regarding disease condition, and fear and anxiety regarding the uncertain outcome of the treatment. Nursing cares for patients with chondromalacia are: assess the client's description of pain, identify factors or activities that seem to precipitate acute episodes, apply a hot or cold pack, medicate for pain before activity and exercise therapy, instruct the patient to avoid activities that create stress on the knee, provide adequate rest periods, support joints in a slightly flexed position using pillows, rolls, and towels, teach muscle balance by strengthening quadriceps, hamstring, abductors, and adductors, and administer analgesics and anti-inflammatory drugs. So far, we have seen regarding the condition chondromalacia patella. It's a condition where the cartilage on the undersurface of the patella deteriorates and softens due to etiologies like wear and tear or overuse. This condition is very common among young athletic individuals, and common clinical features are anterior knee pain, tenderness, and grinding sensation. However, it can be managed by anti-inflammatory drugs, cold application, elevation, rest and surgery. Hope this video was useful and thank you so much for watching. Please don't forget to like, share and subscribe to my channel. Thank you.